I think there was a gap for a very long time in the healthcare landscape when it comes to this population. So I think there was a pent-up kind of interest in this.
Corktown Health, can I help you? This is Wendy speaking.
Corktown Health is Michigan's first nonprofit LGBTQ-focused medical home. We're located in the Corktown neighborhood of Detroit, just outside of downtown. We opened in 2017 in August, and since then, we're just about 5 years, have served over 4,000 patients. Generally speaking, we're a full-service primary care center. People could come here for chronic disease management or just general care. We have primary care, geriatric care, cancer screening, HIV treatment, treatment for STIs. We did a lot, for example, during COVID and with a monkeypox vaccine last summer. We do a lot around the issue of trans healthcare, affirming trans healthcare, which can look a lot of different ways, but our providers are trained in that, and thus we've seen a lot of patients who come to us looking for that kind of care. I think some of the stigma elements and barriers for LGBTQ people when it comes to healthcare is, one, there aren't a lot of known providers. Not a lot of medical providers make themselves known as an LGBT affirming provider to the community. By coming out, if you will, to your provider, or having a provider who's willing to have you come out to them without any reaction, is affirming, right? And you feel more comfortable. And I think that we bring that to our patients.
Corktown Health is important for the queer community for the fact that it exists. It is here, it is involved in the local community, it's at the ground level, and it engages the community. You're greeted at the front desk, so every time I walk in, Abby's there. It's a very consistent experience, and you get to know the people that you work with. They make sure that the conversation is robust enough to be able to turn over multiple stones and different conversations and different perspectives on certain topics in healthcare. It's, okay, let's zoom out. Where are you at with your stress levels at work right now? How's your mental and emotional health? What are the other factors within your entire environment that could be attributing to what you're feeling at this point in time? And then they get to the tactics and the strategies of which, could be used to intervene for healthcare.
The partnership with Blue Cross Blue Shield of Michigan is absolutely critical to our founding and to our the earliest phase of our development here. Blue Cross's significant contribution at the beginning helped us hire our first medical director. In each year since then, Blue Cross Safety Net Program has provided a grant to our program that allows for operations, which is really significant. If you're in the grant writing world, that not a lot of people fund operations. As leaders in the health space in Michigan, they're critical partners to have. I've met more people and had more opportunities to hopefully influence affirming care around the state through my relationships with Blue Cross Blue Shield of Michigan.